If you have spider veins that you'd like to get rid of, but you keep putting it off, you may want to get it checked out before it turns into something more serious. We recently stopped by the Vein Center to find out how they can help.
So typically people with untreated varicose veins will have a lot of swelling. They could have pain and achiness to their legs. In addition, they could have darkening around the ankles, which a lot of times people aren't really sure what causes that. So they may notice that in themselves or their family members, or even people walking around wearing shorts, this darkening around the ankles, and it just looks very unsightly. Sometimes it could progress into a very woody appearance, very thick, leathery appearance, and then as it progresses, it eventually turns into an ulcer, which can take a very long time to heal. So if you find that you have an ulcer on your foot, typically your primary care doctor may identify this. You may be sent to a wound care center. However, one of the things that we can provide is, besides just the wound care, is also treating the cause of the ulcers to prevent recurrence.
Not all varicose veins become wounds that won't heal. Oftentimes, varicose veins can be treated at the Vein Center with sclerotherapy.
Sclerotherapy is something that we offer for women or men of any age who have found themselves with spider veins or reticular veins. Essentially, anything that's on their legs that bothers them. Normally this is something that it's a sightly problem. Here at the Vein Center, not only do we treat the root of the problem, the vessels deep down that could be feeding into those spider veins and reticular veins, but we offer sclero, which is a small injectable type solution that is able to improve the appearance of these veins. And there are a few things that are important to keep in mind when you're looking into sclerotherapy. It's important to make sure that you're covering all aspects of your therapy, from what's causing it in the beginning and what to expect in the end. And we would follow you through from your initial evaluation, getting ready for sclero, and also following up afterwards to make sure that you're pleased with your results.
Well, I have lived with varicose veins for a long time, actually 31 plus years. I got a varicose vein my very first pregnancy, and it hurt the entire 9 months I was pregnant on 5 different children. It would throb at night where I couldn't go to sleep, just very annoying. So I decided, okay, I am going to go to the Vein Center and have someone look at this and see if there's something that they can do to help me to make my life not so miserable. So anyway, I went in, and all the people that worked here were great, and they told me yes, they would be able to help me. And I had the surgery done, and it was amazing.
So a lot of people ask about spider veins and whether treatment of the spider veins alone will be enough. I like to use an analogy of using a tree that's growing inside your living room. If we only treat the spider veins and not really address the root cause, it's the equivalent of just trimming the branches off a tree in your living room, but you really need to remove the whole tree from your house and get it out of the house. Otherwise, the branches will come back.
The Vein Center has locations in Belle, Meade, Cool Springs, and in Mt Juliet. To say goodbye to varicose veins, give them a call at 615-269-9007 or log on to veinreliever.com.